Hi guys, my patient is 93 years old. She is alert and oriented times 3. For talking, she's able to have a normal conversation back and forth with you, but she does have Alzheimer's disease, so sometimes it can get confusing while having this conversation with her. She can get agitated sometimes when she overthinks. When she does get agitated, she has a cat for real stuffed animal in her room that you give to her when she does get agitated, and this seems to calm her down. She really likes cats. For walking, she uses a Hoyer lift. She also has a Brado chair that she goes into after the Hoyer lift, and she uses her feet to move around in that chair. She is incontinent. She needs a 2-person assist when changing her briefs. She usually has a BM in the mornings when I was there for clinicals. She eats all of her meals. She had 2 out of 2 pieces of toast. She ate all her oatmeal, 100% of her orange juice, but she doesn't like eggs, so she didn't touch those at all. And she doesn't use any assistive devices when she's eating. So the vital signs I assessed in my family member today, their pain was a 0 out of 10. Their blood pressure was 112/66, and I took this while they were sitting on their left arm. Their pulse was 76 beats per minute, left radial, and then the respiratory rate was 14 beats per minute. It was not labored, and this was taken when they were laying down. The temperature was 97.8 degrees Fahrenheit, and I took this orally. When I assessed respiratory system, they had eupneic breathing. It wasn't labored. They had erect posture, and there was equal chest expansion. With percussion, there was no pain. I heard resonance throughout, both anteriorly and posteriorly for all lung fields. With auscultation, I heard normal lung sounds throughout, both anteriorly and posteriorly. There was no crackles or no bruits, and didn't hear any of that throughout all the lung fields. I assessed the cardiac system, the radial pulses. I would grade them 2+ strength equal bilaterally. The carotid pulses were +2 strength equal bilaterally. The posterior tibial pulses were +1 strength equal bilaterally. Dorsalis pedis was a +2 strength equal bilaterally. There was no pitting edema in the lower extremities. The cap refill time in both the upper and lower extremities were 2 seconds, which is a normal expected finding, which would be less than 3 seconds, so those were both good. When I auscultated to the heart sounds, I heard normal heart sounds. S1 and S2 were both present. There were no adventitious sounds or no carotid bruits that I heard. When I assessed my patient's GI-GU system, I heard normal active bowel sounds throughout all 4 quadrants. With percussion, there was no pain for my patient. I heard tympany throughout all 4 quadrants. I didn't feel any masses. I used the hooking technique to feel the outside borders of their liver, which I could palpate. And then for checking rebound tenderness, they didn't have any pain in the opposite quadrant. And then I also assessed the patient's skin while I was doing that. And I noticed for both upper and lower extremities, the skin color was even throughout. And there was no signs of any skin breakdown throughout both upper and lower extremities. And then when I assessed neuro on my patient, I was able to tell that their cranial nerves were intact by just performing my assessment. They were able to follow what I was doing with their eyes. They were able to have a normal conversation with me and communicate back to me. And then I also assessed sharp versus dull pain on my patient in both the upper and lower extremities, and they were able to differ between the sharp and dull pain for both upper and lower extremities equal bilaterally. And then I performed range of motion on my patient in the upper extremities. They were able to abduct and adduct both of their arms with and without strength equal bilaterally, and then they were able to supinate and pronate their palms of their hands with and without strength equal bilaterally, and then they were able to protract and retract their forehead with and without strength. And then for the lower extremities, my patient was able to abduct and adduct both of their legs with and without strength equal bilaterally, and then they were able to dorsiflex and plantar flex both of their feet equal bilaterally with and without strength. And then that was it. That is all I have for you today.